Welcome back, everyone, to another daily deep dive into healthcare news.
I'm always excited to see what stories you've managed to unearth.
Well, buckle up, because today we're sifting through a mountain of updates.
Oh, really?
Yeah, from sources like Becker's Hospital Review Health Commentary, Kevin MD.
Sounds like we've got a full plate.
We do. We've got AI advancements that are honestly mind-blowing.
I'm all ears.
And then some pretty heated policy debates.
Can't wait to unpack those.
And a few stories of medical ingenuity that'll just leave you inspired.
Always love those.
So let's dive right in. All right, AI first. It's everywhere these days. Every headline seems to be screaming about it.
It's true AI is having a moment in healthcare, and for good reason.
Speaking of headlines, I saw one about this massive jump in physician adoption.
Yeah, that's right. The American Medical Association did a survey.
Oh, yeah.
And they found that physician adoption of AI nearly doubled in just a year.
Doubled. Wow.
Yep, from 38% in 2023 to a whopping 66% in 2024.
That is a huge leap. So what's driving this sudden surge?
Well, for one thing, the tools themselves are getting better. More sophisticated, but also easier to use.
Makes sense. I guess clunky tech isn't going to win anyone over.
Right. And more importantly, we're seeing real evidence that AI can make a difference, improving efficiency, helping with documentation, even leading to better patient outcomes.
Okay, so less paperwork, more time with patients, more lives saved. Sounds like a win-win-win.
Potentially, but we need to be cautious too.
Oh, of course, right. Too good to be true and all that.
Some experts are waving some pretty big red flags about rushing into AI development without proper safeguards.
Like what kind of safeguards?
Well, take Demis Hassabis, for instance.
Google DeepMind's CEO.
Right? Yeah. He's actually warning about the dangers of an AI race in healthcare.
An AI race. What does that even mean?
Basically, he's saying that if we focus too much on speed and not enough on safety and ethics, things could go south pretty quickly.
So AI misdiagnosing patients or making critical decisions without human oversight, that kind of thing.
Exactly. Those are the nightmares that keep people like Hiten Shah up at night.
Who's Hiten Shah?
He's the CEO of the British Academy, and he's been very vocal about the need for robust data quality and AI safety in healthcare.
It's a valid concern. AI is only as good as the data it's trained on.
Right. Garbage in, garbage out, as they say.
Exactly. So how do we make sure we're not building a healthcare system on a foundation of garbage?
That's where this whole idea of explainable AI comes in.
Explainable AI?
It's basically about designing AI systems that can show their work.
Show their work.
So instead of just spinning out a diagnosis or a treatment plan, they can actually explain the reasoning behind it.
Oh, so doctors can understand how the AI arrived at its conclusion.
Right, and that builds trust both for the physicians using the tool and for the patients whose lives are affected by those decisions.
Transparency is key. That makes a lot of sense. So besides explainable AI, what other AI advancements are shaking things up in healthcare?
Well, AI scribes are becoming increasingly popular.
AI scribes, what are those?
They're basically digital assistants that can listen to patient encounters and transcribe everything that's said.
No more scribbling notes.
Exactly, and then they can extract relevant medical information and populate patient records.
Talk about a time saver.
It could be huge for physician burnout, but again, we need to be mindful of potential risks like data privacy and algorithmic bias.
It's a powerful tool, but it needs to be used responsibly.
Absolutely. And speaking of powerful tools, there's been some incredible progress in using AI for cancer detection.
Oh yeah, I read about that. It's detecting cancer on CT scans, right?
You're thinking of the AI model for automated colorectal cancer detection?
Yeah, that's it. How accurate is it?
Early studies are showing some really impressive accuracy rates.
That's amazing. Early detection is crucial for cancer treatment.
It could be a game changer, potentially saving countless lives.
It's incredible to think about the possibilities, but AI isn't the only thing making waves in healthcare these days.
Oh no, not even close.
Policy-wise, things are heating up as well.
Definitely Medicaid is back in the spotlight, for example.
Again, with the work requirements.
Yep. With President Trump back in the White House, the push for those requirements has returned.
I thought some states were already doing that.
They were, and some, like South Carolina, are eager to implement them, but others are actually scaling back.
Really? Like which states?
Georgia and Arkansas, for instance.
Interesting. So it's not a universally popular idea even within the same party.
Not at all. It's become a real political and logistical tightrope walk.
So Medicaid work requirements are back on the table. What else is going on in the policy world?
Well, the confirmation of Robert F. Kennedy Jr. as HHS Secretary has sparked a lot of controversy.
Oh yeah, his stance on vaccines has a lot of people worried.
That's putting it mildly. Public health experts are deeply concerned about the impact his views might have on policy.
But didn't some business leaders come out in support of his appointment?
They did. Some are optimistic about his Make America Healthy Again movement. They see it as a chance to shift focus to preventative care and address environmental health concerns.
So a very mixed bag of reactions, to say the least.
Absolutely. You could say that again.
Are there any other political developments we should be aware of?
Well, the White House just directed the CDC to lay off nearly 1,300 probationary employees.
Wow, that's a lot of people. What's the reasoning behind that?
The administration haven't been very specific, but it's likely part of a broader effort to reduce government spending.
It seems like a risky move to cut public health jobs, especially after everything we've been through recently.
That's the concern among many health experts. They worry it could weaken the CDC's ability to respond to emerging threats.
Makes you wonder what impact those aluminum and steel tariffs will have on the healthcare industry.
Right, that's another big question mark, and the medical device industry relies heavily on imported aluminum and steel.
So those tariffs could drive up costs.
Potentially. And who ends up paying for that? Ultimately, patients do.
It's a reminder that economics and healthcare are inextricably linked.
They are. You can't separate one from the other.
Well, all this talk of politics and economics is starting to feel a bit heavy.
I hear you.
Let's shift gears and talk about something a little more uplifting.
Sounds good to me.
I was really moved by that story about surgeons tackling the silent epidemic of chronic pain.
Chronic pain is a massive problem, often misunderstood and undertreated.
And it's not just a problem for the elderly. I've noticed even celebrities like Billie Eilish and Kathy Bates speaking out about their struggles with chronic pain.
Their advocacy is so important. It helps to destigmatize the condition and encourages people to seek help.
Absolutely. It's a reminder that there are real people behind these statistics, people whose lives are deeply affected by this condition.
And sometimes it's the simple solutions that make the biggest difference.
Like what?
Like that story about the New York hospital that dramatically reduced pressure injuries.
Oh, yeah. What was their secret?
They implemented a comprehensive prevention program, regular skin assessments, specialized mattresses, meticulous wound care.
And it worked.
They reduced pressure injuries by almost 70%.
That's incredible proof that dedication and attention to detail can make a real difference.
Speaking of dedication, the story of Dr. Charles Richard Drew is truly inspiring.
Dr. Charles Richard Drew, refresh my memory on his contributions.
He's considered the father of the blood bank. His pioneering work during World War II revolutionized blood transfusion and saved countless lives.
Wow, so the blood drives we see today are a direct result of his work.
In many ways, yes. He developed techniques for collecting, processing, and storing blood safely. His efforts led to the creation of the first large-scale blood banks.
It's amazing to think about the lasting impact one person can have on the world, especially in a field as vital as healthcare.
It really is. Dr. Drew's story is a testament to the power of innovation and a reminder that even in the face of immense challenges, one person can make a difference.
This deep dive has been incredibly insightful. We've covered a lot of ground, from the rise of AI and its potential impact on medicine to the complex policy decisions shaping the healthcare landscape, and of course the inspiring stories of human resilience and innovation that remind us of the heart of healthcare.
And our deep dive isn't over yet. Join us in part 2, where we'll delve into some thought-provoking pieces that explore the ever-evolving dynamics of healthcare, including the distinction between disruption and innovation, and the growing trend of open communication about mental health at work.
It's amazing how much ground we covered in just the first part of our deep dive.
It's true, healthcare is such a dynamic field. There's never a dull moment.
And we're not done yet. We've got more thought-provoking insights to unpack.
Right. Let's dig into some of the more nuanced discussions happening within healthcare.
Sounds good to me. One thing I've been thinking about a lot lately is this whole idea of disruption versus innovation in healthcare.
It's a hot topic for sure. Everyone wants to disrupt the industry, but is that always the best approach?
That's what I'm wondering. Sometimes it feels like change for the sake of change.
Exactly. And that's where the distinction between disruption and innovation becomes crucial.
So what makes true innovation different from just disruption?
Thought leaders like Mike McGee and John Bertner have been exploring this very question.
What are their takeaways?
Well, they argue that disruption often focuses on breaking down existing systems, which can be necessary sometimes.
Right.
But true innovation goes beyond that. It's about building something better in its place, something that addresses real needs and creates lasting positive change.
So it's not just about shaking things up for the sake of it.
Right. It's about understanding the problem deeply and then finding creative solutions that actually improve people's lives.
And that often requires more than just technology, right?
Absolutely. It's about bringing together scientific breakthroughs, technological advancements, and a deep understanding of the human element in healthcare.
That human element is so crucial.
It is. And speaking of human elements, let's talk about the growing trend of open communication about mental health at work.
It's definitely a shift. I've noticed more and more people feeling comfortable talking about mental health challenges,
It's a positive sign for sure. The stigma around mental health is slowly but surely fading.
which is so important because mental health is just as important as physical health.
Exactly. And when employees feel supported and able to discuss these issues openly, it creates a healthy and more productive work environment.
No more suffering in silence.
Right. It's about recognizing that we're all human and we all face challenges in life.
But how can employees start these conversations, especially if they're not sure how their manager will react?
That's a valid concern. It's important to approach these conversations thoughtfully and strategically.
Any tips?
Well, first of all, choose the right time and place.
Don't just blurt it out in the middle of a meeting.
Right. Find a private setting where you can have a focused conversation.
Makes sense. And what about the content of the conversation? Any advice there?
It can be helpful to frame the conversation in terms of your work performance. Explain how your mental health is impacting your ability to do your job effectively.
So instead of saying, I'm having a mental breakdown, you might say, I'm feeling stressed lately, and it's affecting my focus.
Exactly. It's a more direct and professional approach.
And it shows that you're committed to your work while also acknowledging that you need support.
And remember, you're not alone. Many people struggle with mental health. Your manager may have their own experiences to share.
That's a good point. It's about fostering a sense of empathy and understanding.
On the flip side, HR leaders are facing their own set of challenges when it comes to mental health and well-being in the workplace.
Especially with the staffing shortages and burnout we talked about earlier.
It's a perfect storm for HR departments. They're trying to recruit and retain top talent while also creating a supportive work environment.
That's a lot to juggle.
It is, and it's forcing them to get creative with their strategies.
Like, what kinds of things are they doing?
We're seeing hospitals offering signing bonuses, flexible work arrangements, even student loan repayment assistance.
Wow, those are some pretty attractive perks.
It shows that they're starting to recognize the importance of investing in employee well-being.
Because a happy and healthy workforce is a more productive workforce.
Exactly. It's a win-win for everyone involved.
This deep dive is really giving me a new perspective on the complexities of healthcare.
It's like we're peeling back the layers of an onion.
And there's always another layer to uncover.
That's the beauty of it. There's always more to learn and explore.
I'm eager to hear what other insights await us as we continue our journey.
Join us in part 3 as we wrap up our deep dive and leave you with some final thoughts to ponder.
We've covered so much ground in this deep dive.
We have. It's been a whirlwind tour of the healthcare landscape.
The rise of AI to the complexities of policy and the inspiring stories of human resilience.
It's amazing how Ronix pieces fit together.
It is. It paints a vivid picture of the challenges and opportunities defining healthcare today.
And it highlights the fact that healthcare is constantly evolving.
There's always something new to learn and explore.
Exactly.
One thing that's really stuck with me is this sense of immense challenge, but also incredible opportunity.
It's a unique moment in healthcare. We're facing a convergence of factors.
Like what?
Well, an aging population, for one.
Right.
Rising healthcare costs, staffing shortages, a rapidly evolving technological landscape.
And of course, the political battles and the lingering impact of recent health crises.
It can feel overwhelming at times.
It can. But amidst all those challenges, we're also seeing incredible innovation.
Absolutely. There's a renewed focus on patient-centered care.
And groundbreaking advancements in areas like AI and telehealth.
We're starting to recognize the importance of addressing social determinants of health.
It's like we're finally acknowledging that healthcare is about more than just treating diseases.
It's about creating a healthier society as a whole.
And that's where our listeners come in.
You mean?
Yeah. What role do we as individuals play in shaping the future of healthcare?
It's a question we should all be asking ourselves.
Because it's easy to feel like these big issues are beyond our control.
I know what you mean. But the truth is, the future of healthcare isn't solely determined by policymakers or researchers or even healthcare professionals.
So what can we do?
We can advocate for policies that promote access to affordable, quality healthcare.
Okay.
We can support organizations working to improve health equity. We can volunteer our time at local clinics or hospitals.
Those are all great ideas.
And perhaps most importantly, we can all make an effort to stay informed.
About healthcare news and developments.
Exactly. The more we understand about the healthcare system, the better equipped we are to advocate for positive change.
Knowledge is power.
It truly is.
Well, this deep dive has definitely given me a lot to think about and a renewed sense of purpose when it comes to healthcare.
That's what we hope for with every episode.
To leave our listeners with a broader perspective, some aha moments, and maybe even a spark of inspiration.
To make a difference in their own way.
And on that note, we'll leave you with a final question to ponder. What resonated with you the most from today's exploration?
Was it the rapid rise of AI, the controversial policy decisions, or the stories of human resilience and innovation?
Whatever sparked your curiosity, We encourage you to keep exploring, questioning, and engaging in conversations about healthcare.
Because together we can create a healthier future for all.